TopMedTalk.
Welcome to TopMedTalk, the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. Stand by for a healthy conversation. But first, the 2026 International Practicum on Cardiopulmonary Exercise Testing will be held from September the 16th to the 18th of this year. It is organised by iPoets, the International Perioperative Testing and Training Society. Come and join us at this premier educational event designed for clinicians, scientists and healthcare professionals interested in sport, exercise and perioperative medicine. Check out ebpom.org for the best prices and information now. That's ebpom.org. And remember, this is an International Perioperative Testing and Training Society accredited event. So when you attend, you can get your iPoets accreditation showing that you are a practitioner who has reached a high standardized level of competence in performing and interpreting cardiopulmonary exercise testing for patients preparing for major surgery. Check out ebpom.org now.
Hello, welcome to TopMedTalk. I'm Andy Cumpstey and I'm here in Rotterdam at the Euroanaesthesia meeting, which is the annual meeting of ESAIC, the European Society of Anesthesiology and Intensive Care. And I'm delighted to be joined by Wolfgang Buhre. I'll let you introduce yourself, Wolfgang.
Yeah, thank you very much. Wolfgang Buhre. I'm Professor of Anesthesia and Perioperative Medicine in the Netherlands and at the Utrecht University Medical Center. I'm also the director of all medical specialties in that hospital. But in Rotterdam, my role is that I'm the past president of the European Society of Anesthesia and Intensive Care.
So, as I'm sure you know, TopMedTalk's got a totally international listener base, so some of our listeners may not have been fortunate enough to come to the Euroanaesthesia meeting. Yeah. So why don't we start there? So this is the annual meeting of ESAIC, the society. It moves around Europe every year, around this sort of time of year. It typically gets, 3,000, 4,000, 5,000 delegates, something like that?
Yeah, the annual meeting at least takes place in nearly every country in Europe. And our community is in the range of 5,000 people. Sometimes a bit more, sometimes a bit less. Interestingly, approximately 1,000 of the delegates come from far abroad, Australia, India. We have a lot of colleagues from the Americas, so it's a world congress, to be honest. It's organized by the European Society of Anesthesia and Intensive Care. It's a central European meeting. We have a lot of others. As some of you probably know, we represent more than 40 countries in Europe, and every country has its own national society with its own congress, but everybody comes together here once a year, and this year it is Rotterdam, and next year it will be Copenhagen.
Excellent. Well, whilst we're on Copenhagen, do you want to give a bit of a plug for when that is? I think it's the end of May from memory.
Yes, it's always end of May, beginning of June. I think next year we will be there end of May. Well, for next year, we have just today discussed what is the priority. Euroanaesthesia has always one central topic, one headline. This year, the headline was leadership and the white paper of the European Society of Anesthesia and Intensive Care. We will discuss it a bit later. Next year, we're thinking about which headline we should organize the Congress around, and we have 3 excellent proposals, and within the next weeks we will decide what will be the proposal. But you're not wrong when you're thinking about resilience, communication, data transfer, and patient journeys. So I think all of these things will be very well presented also next year in Copenhagen.
And my experience of this meeting this year and previous years is it's always had an excellent scientific program, lots of poster presentations, lots of fantastic speakers, all topics of anesthesia and intensive care covered. And this year there's been some really, really exciting simulation sessions. I keep walking past people who've collapsed in the corridors, and there's a big group of people around them doing their thing and then having their debriefs afterwards with all the makeup on. And we've had people collapsing down by the side of our podcast booth, and so quite innovative sort of events that people can get involved in if they come and visit. But you mentioned, so one of the themes this year has been leadership and the white paper. And again, we've already recorded with Joanna Berger about some of the leadership work. Yeah. And that'll be a separate TopMedTalk episode. But let's talk about the white paper then. Yeah. So if you could tell us what the white paper is and particularly why it was initiated.
Well, the European Society is a bit more than 20 years old. And within these years, we developed a reputation in education and research, organizing a congress, patient safety, and also diversity, equity, and inclusion in the last years. However, what we want to do last year and this year is we want to present ourselves, our specialty, for ourselves, but also for the stakeholders. We realized that still for a lot of people, the role and the position of an anesthesiologist is relatively unknown. And as we know that in normal hospitals, 70 to 80% of patients are in contact with anesthesiologists, and relatively often during some of their most difficult periods in life, then we were pretty sure that we have to spread that message, not only within our community of anesthesiologists, but also outside of our community. And that means, in practical sense, politicians, stakeholders, sometimes insurance companies, etc. So there was a broad interest from our own community, from stakeholders, but also from our industrial partners. And the white paper aims to reach that goal, to present ourselves, to present our core values, and to present also what are our strategic goals in 2026, given the situation we have to face in healthcare in Europe.
And how was it put together and constructed?
First of all, we worked together with a very good company to get it done. We did a lot of interviews. It was classical qualitative research. We asked a lot of people within and without our community, including the board of ESAIC, those responsible for education, research, science. But also we moved around and asked people which has some interaction with our specialty. And then we did a lot of desk research. In other words, we looked all over what is known about the specialty, which kind of information is normally given to our patients, but also to those which are responsible for instance, for the budget for healthcare. So we try to keep it as broad as possible, and therefore it was a process which I spent at least 2 years to get it done appropriately.
So a huge amount of work with clinicians, policymakers,
Yes.
patients as well. And
Yes, we also had a couple of discussions with patients or patients' relatives. Most of the time we organized it that way that the anesthesiologist involved had the duty to talk, for instance, with patients' organizations. In other words, I, for instance, had a conversation with those I'm normally working together in the Netherlands to get some insights about what does our specialty mean for the patient. Are we visible for the patient? Are we only necessary, or can we contribute? So I was very much interested, what's the role, but also the wish, how an anesthesiologist should act from the patient's view.
And what did all these important stakeholder groups conclude? What does the paper contain?
Well, basically, we designed it that way that 3 areas of interest become quite apparent. Because as we all know, this white paper needs to be very focused. The first thing is that we have severe struggles in Europe with the workforce in perioperative medicine, in healthcare in general, but in highly specialized areas like perioperative medicine, intensive care, emergency care, much more pronounced than in other areas. There are a couple of reasons why this is the case. The heterogeneity in Europe in terms of education schemes, salaries, working conditions. So we have done a lot of surveys the last years about the working conditions in Europe for staff members and residents, and we put that information into the system. The shortage we face will dramatically increase in the upcoming years in anesthesiologists. And we place a clear message to the stakeholders at the European, but also the national level, that we have to work on that topic. We cannot accept that the anesthesia and perioperative workforce will dilute, because we know that this has enormous effect on the second big parameter, patient safety. Patient safety in Europe is quite high. We have, as anesthesiologists, a success story which is unbeatable. And the operating theater is one of the most safest places in the hospital momentarily. In other words, we have developed a couple of very good things to make this area for patients safe. And we see that this is definitely related to the availability of qualified people running that environment, being there. Second thing is, as we all have learned also during COVID, there is a shortage of goods. A lot of things which were quite certain 5 to 10 years ago are not certain anymore. Medication is missing. Some disposables are not freely available. So we place a very clear message to the national, international stakeholders to take care about the availability of the goods we need to perform safe care. I think this is a quite important message, because in Europe we have lists of critical medicines, for instance, and we actively ask them to add some medication, some disposables, some machines we urgently need, because this is a patient right to get the best possible care in times when it is a bit more difficult to organize this. But we can do so. In Europe, healthcare is very fragmented. However, the education of people can be organized quite standardized and quite applicable. And as you know, the European Society for a long time has a relatively active education department, including the European Diploma of Anesthesia and Intensive Care. So we are also able to offer to the European organizations, let's say, the goods, the toolkit to take care of a standardized education, which I think will be very attractive for the majority of countries.
So I think, workforce planning, patient safety, sustainability and education are all clearly key themes that will resonate with all of our listeners wherever they are in the world. So it's great that ESAIC is on point with this document. What do you want the impact of this to be? I mean, what's the vision going forward with now this is produced? What comes next?
Well, the next steps will be divided. First of all, we just set up a task force which will focus on our relations in particular to the European organizations, namely the European Commission and the European Parliament. So we will actively spread the message in that fields. And we also will actively communicate with our partners, mainly from industry, which are working together in the medtech organizations. So we will spread this message also there, and we will actively search for ways to reduce the burden to get, let's say, to guarantee the most optimal patient care. Third, we will increase our activities in the Biomed Alliance, which forms an organization where the medical specialties are working together to influence the decision makers. These are very practical steps from the advocacy perspective. Moreover, we will develop toolkits for individual countries, because we realize that a lot of the societies in different countries also need to have this contact with their local and national governments. So we will help them to produce appropriate material to realize improvements on a national level, besides the European one.
Great. Well, thank you very much for all you're doing, and thank you for advocating so well on behalf of our specialty. And thank you for joining us here on TopMedTalk. As always, thank you for listening at home. You can find this episode and all our other episodes in the back catalogue on our website. That's topmedtalk.com. A huge thank you to ESAIC for hosting us here at Euroanaesthesia. It's always a great meeting and great for us to be a part of it this year in Rotterdam, as we've said. A big thank you to our sponsors that keep us free and open access around the world. And this year, that's BD Advanced Patient Monitoring and GE Healthcare. And finally, thank you to you for listening. If you do have time, please do find us on social media. We're on all the main platforms, and hitting like and subscribe on there really does help us too. So please go ahead and do those things, and we'll see you next time. Thank you.
TopMedTalk.
And remember, the 2026 International Practicum on Cardiopulmonary Exercise Testing will be held from September the 16th to the 18th of this year. Come and join us at this premier educational event designed for clinicians, scientists and healthcare professionals interested in sport, exercise and perioperative medicine. Check out ebpom.org for the best prices and information now. That's ebpom.org.